For Global Medical News Network, I'm Heidi Spleet, reporting from Washington, D.C. at the annual meeting of the American Academy of Pain Medicine. What are some of the challenges of identifying and managing SI joint pain in particular?
Well, I think the challenges are twofold. Number one, the challenge is that SI joint pain, which is usually pain in the buttock area, can just be in the buttock. It can radiate down the leg. And given the fact that things such as nerve roots in the back can cause pain just in the buttock or down the leg that can replicate SI pain, discs that have annular tears can cause similar pain in just the buttock and occasionally down the leg. Muscular pain in the buttock or the back can cause pain in the buttock or down the leg. Facet pain can be referred down the leg, such as Dr. Bogduck's illustrated that for us in the past. All these things can cause pain in the same location as SI joint pain. History can be very helpful. Physical exam can be predictive. Something such as the Fortin finger test can give a 70 to 80% positive predictive value, but there's always those that you can miss on history and physical. So the challenge for SI joint pain is number one, finding an individual who seems to have a history and physical that matches SI joint pain. And then the secondary challenge is to really identify that problem for sure. A diagnostic block with a local anesthetic is helpful, and a positive response to that block is helpful in confirming SI joint pain. And quite often, more than one block with positive response on each is needed to also minimize the placebo effect.
What are some treatment options for patients with SI joint pain?
Well, once SI joint pain has been definitively established by response to anesthetic block and sequential blocks and good positive pain response, then the treatment options can begin. Now, understand that sometimes people will get some long-term response to an anesthetic block, whether it's combined with steroid or not. So sometimes that can serve both as the diagnosis and the treatment. So that's one option, is simply injections. Sometimes long-term response of 6 months or greater can be seen. Other times the response is only short-term, that there's relief during the phase of the anesthesia, and whether corticosteroids are added or not, the response is for hours or days or weeks, and it is not long lasting. So at that point in time, denervation or rendering the joint insensate by means of burning the nerves to the joint, and when I say burning via radiofrequency devices, is utilized. And there are different ways of approaching that.
For Global Medical News Network, I'm Heidi Spleet.